have got breaking news right now with this COVID healthcare crisis. Look, we're about to head into our Alexandria agency where Gayla Gunner, our clinical director over all of our agencies, is here, and Christine Moe, our director of nursing, where they are going to give you the latest and greatest information on how you can be prepared for this crisis and how we can continue to take care of you and your family at this time. Remember, our nation's healthcare workers shine the brightest in times of chaos. Stay tuned.
Hi, I'm Amber with Lagniappe Home Care. Today we want to provide you with the latest information on the COVID-19 healthcare crisis. So Gayla, can you give us some information on COVID-19 and how critical it is within our home health communities?
Sure, I can. So we're hearing a lot today in the news about COVID-19, which is also known as the coronavirus. We know that it first began in an outbreak in China that has since spread across the world, and most recently in the last few weeks has begun to significantly affect the U.S. So what you're going to be seeing is kind of like flu-like symptoms, but it's going to be more respiratory symptoms that may be mild at first, but will progress from there. You're going to have fever, cough, shortness of breath, things like that. But what is really important is to know how you can protect yourself. You will be hearing things like social distancing, flattening the curve. So really what we're trying to do is limit our exposure to the outside world. You want to do things like avoid close contact with anyone who is sick. You're going to want to avoid touching your hands, your eyes, your mouth, anything with your hands that haven't been washed or clean. Talking about washing hands, that is one of the most important ways to prevent the spread of this infection or any infection, is practicing good hygiene. The CDC recommends that we wash our hands with soap and water for a minimum of 20 seconds. So that is extremely, extremely important to use. If soap and water is not available, alcohol-based sanitizer is also recommended to use. But when you're sick, very important, stay home. Avoid people when you're sick. When you cough, you sneeze, cover your mouth. Sneeze into a tissue, things like that. And then anything that's dirty, disinfect the surfaces with like Clorox wipes and things like that. Just to keep a good, clean environment. And like I said, when you're sick, stay home and just practice good basic infection control measures.
Okay. So Chris, what is our Lagniappe Home Care team doing specifically in this time to keep our patients safe?
We are continuing infection control practices and trying to prevent the exposure between patients, and we continue to educate the staff and the patients on a day-to-day basis on any changes that are happening.
All right, Gayla, so back kind of what you said before, what is something that we can do to do our part in the community to keep this at bay?
So what we're doing is for Lagniappe Home Care is the same with everybody else. We're educating our staff on a continual basis. Every day they're updated on what's going on. We're making sure that they have the latest information available that we have. We are continuing to educate them on making sure that they stay atop of what they need to identify their patients. We assess our patients at every single visit. We make a lot of phone calls checking on our patients, but our whole goal is to continue to provide that consistent care, that good quality care that we provide every day to our patients. We at Lagniappe want to make sure that we support our patients through this time and meet all the needs that they have, because our patients are important to us at Lagniappe Home Care.
All right. So Chris, we know it's really difficult to get out in this time right now when people are sick. So what do we have for those patients that are getting discharged from the hospitals and nursing homes and rehabs? What are some things we have in place for them?
We encourage them to call us first. That's the main thing for home health, is to keep them home and out of the hospital. We continue to screen them in the home, and we stay in contact with the doctor. And back to what Gayla says, we want to stay in touch with them and let them know that we're here to keep them out of the hospital.
We are your local leader in home care.
Choose local, choose Lagniappe.